Hey everyone, welcome back for another episode of Coffee with Mare. And today we're going to talk about migraines. I was diagnosed with migraines probably about 7 years ago, and I've learned a lot about the term migraine and what that means and the different types of migraines that there are. Over the years, I've had to educate myself. And that also has to do with just trying to find strategies that I could use that would help alleviate symptoms. So, your basic kind of migraine, most people think of a migraine that it's a very severe headache. It can start in different parts of your head depending on what kind of migraines you're prone to. And you can have something that they call an aura. Before having to deal with a lot of migraines, and we'll get to that in a minute, I always thought like an aura was like people would start seeing spots or stars or, something that was mostly visual. And, then I started hearing about how some people that have severe migraines, they get a lot of nausea and, that kind of made sense, right? What I didn't know is that migraines can also show up with other neurological symptoms. And this was something that really threw me for a loop. Early on, when we were still trying to figure out what was going on, and before I had any sort of diagnosis and we were eliminating things, I had noticed I had some really weird issues. Like, I would start getting pins and needles in my legs, and sometimes I felt like I would lose strength in my legs. So like going up and down the stairs in the house I was living in at the time was pretty challenging, and my daughter was quite little at the time. So I always felt like, okay, if we're going up and down the stairs, then I need to make sure that I've got one hand on the handrail. And if I know that I'm having a really bad day, I might not want to carry her up and down the stairs if I'm worried about what's going on with my legs. And there were a whole bunch of other things that were like that. And I had talked to the neurologist that I was going to at the time. And I said, I have all of these weird things that happen. And, like feeling weakness in my legs sometimes, or having numbness and tingling. And, I also get numbness and tingling in my skin, where it actually, like the skin on my arms in particular, starts to feel like it's numb on the surface. So it's like I could scratch my arm and not really, like, I can feel the pressure, but I can't feel the sensation of the scratch, if you will. So according to the neurologist I was going to at that time, he pretty much just lock, stock, and barrel everything I described to him was due to migraines. And, I had an MRI at that point to check and just make sure that it wasn't anything else. And so I was in the clear in that way. But I still felt like, okay, that's really weird. I've never heard of people having those kinds of neurological symptoms with migraines. So I did some digging, and sure enough, that is something that can happen. But that was news to me totally. The whole aura thing, I understood that, yeah, I had aura with my migraines, but then I was informed that, well, there's three types of migraines. There's migraine with aura, migraine without aura, and then there's the aura without the migraine. So you might just be having aura without actually getting the headache, was how it was explained to me. Still thought that was really weird and a little creepy, that it's like, okay, so this is like a silent migraine or something. So I'm not actually experiencing pain in my head, but the rest of my body feels like it's going crazy. And so I really started to track and be conscious of, okay, well, when am I having these kinds of symptoms? Is it when I have the headache? Is it before I have a headache? Is it after? Is it totally unrelated to that, just for my own satisfaction, because I wanted to understand what symptoms were actually being caused by the migraine. So let's also put in a very quick note. At that point, I had not been diagnosed with Ehlers-Danlos syndrome, psoriatic arthritis, fibromyalgia, severe osteoarthritis in my spine, and the list goes on. There were a whole bunch of things there that could have actually been affecting this. But at that point in time, the doctor that I was seeing, that specialist, was unwilling to explore anything other than migraines. And at that time, when I was seeing this doctor, I had also been recovering from a bout of major depression. And I was, well past the point where, like I was taking meds for it, and I was seeing a psychologist, and I would explain to the psychologist how, I would go and see this neurologist, and he would pretty much discount everything I said and told me that it was all related to migraines and depression. And when I would speak with my psychologist, he's like, "No, your head is clear of the depressed state that I was in." He goes, like, "You're in a really good place right now, and it's not really having to do with the depression." So he was also surprised that the neurologist was just constantly leaning on depression to try and write off the rest of my symptoms. So we'll talk more about that part in an advocacy video where I will full on give you details of, some of the things I had to go through to get past that specialist to another specialist who was actually helping me a whole lot more and was very understanding and wasn't dismissive. But for the time being, we had a diagnosis of severe migraines, and I would end up in the hospital sometimes having to get treatment. So there's other terms that go along with migraines. There's refractory migraines, meaning a migraine that is treated and then it comes back. And there's also intractable migraines. Those are migraines that never go away, and that no matter what you do, you cannot get rid of your migraines. I was in an intractable migraine state for almost a year. I was having migraines every day, and it was so debilitating, and I was dealing with all of these other symptoms that I had from my other illnesses, and couldn't get any relief. And so my quality of life was just slipping away. And it wasn't until I was on a preventative medication and also had some rescue meds that I could take when I was having a severe headache that things started to get under control. And just a side note about the preventative medications, be sure to tell your specialist if you have low blood pressure before they put you on some of these preventative ones, because one of the medications I was put on was actually to lower blood pressure, and my blood pressure has always been low normal, and that led to some really, really unpleasant side effects. So, you do have to speak up if you're not feeling well after they prescribe a new medication for you, or also talk to your pharmacist. I find that pharmacists are probably some of the best resources when it comes to, the new meds that you're going on. And if you're having side effects or you think it's a side effect, getting into your specialist, you can't always do that right away. And we have something here called HealthLink, which is a phone number that you can call to speak to a registered nurse at any time, day or night. And they can also walk you through that. They have a series of steps that they will ask you based on your symptoms to try and determine what's going on before they say you should go to urgent care, or you should go to a hospital, or maybe see your physician the next day if you can wait for that. But the the journey to diagnosis was a tough one, and getting control of the migraines was also incredibly difficult. As you can imagine, if you woke up every day feeling like somebody was trying to saw your head open so that they could scoop your brain out, that's kind of what I was living with for a while. And I was extremely light sensitive. My aura tends to manifest with light sensitivity, sound sensitivity, sensitivity to hot and cold, and I also get severe nausea. And I live with severe nausea on a daily basis still to this day. That's one of the things I hope will eventually be healed and go away. Be healed, nausea, go away with carnivore. We're hoping. If we can get some good progress here, that's one of the first symptoms that I would really love to have go away. So when when the migraines were at their worst, I was pretty much unable to work. I was still self-employed at that point, and I was trying to get a business going, and it was so challenging to just get out of bed. And I ended up not really being able to do a lot of work, but thankfully I was plugged into some great leadership groups at that point, and I had a lot of really great support from those people. And and they all knew what my medical predicament was, and that I was having a hard time actually getting some work done because I was just in pain all the time, and the brain fog that accompanied that, as you can imagine, splitting headache. Yeah, it's not like that's really conducive to having a lot of thoughts that are going to, I don't know, be productive, I guess. Most of the time, it's like, oh my God, just make it stop. Make it stop. Somebody get me an ice pack, or I would go find another ice pack. And over time, I found a few things that would help me out a lot. Ice packs are one of them, specifically in the back of the neck. And I usually cover ice packs with a very thin cloth or like a thin tea towel or something, just so that you don't have the contact directly with your skin and freeze or damage your skin. So I have soft, like they're like gel ice packs that are perfect because you can actually lie down on them and it doesn't hurt too much. Or putting an ice pack on your forehead works really well too when you're lying down. Another thing that works wonders is peppermint oil. Peppermint oil is like 9 different kinds of awesome when you have a headache. And it smells good. It's not a smell that ever makes me nauseous personally. It may not be something that you like the smell of, but from a therapeutic level, it's very interesting because just inhaling peppermint oil, just smelling, okay, it blocks a neurotransmitter called substance P. And substance P is responsible for transmitting pain signals. And it actually blocks substance P. So something so simple like peppermint oil and I found this out when I was doing a course on neuroplasticity, but that just having that drop of peppermint oil on my Alfie. And if you haven't met Alfie yet, please watch the Ehlers Danlos video because he's my emotional support stuffy. But I usually just put a drop on the back of his neck, and then when I lie down, I put him on my chest, and I can just smell the peppermint oil, and it starts giving me relief. Like, even on the worst days, it still just kind of helps to take the edge off just a little bit. So if nothing else, if you don't get anything else from this video, if you have chronic pain or migraines, you need peppermint oil in your house. It's indispensable. So I also had to go through a very long process of trying out different drugs for rescue meds. And what I mean by rescue med is not the preventative or prophylactic type medication that is there to try and stop the migraines before they happen or to reduce the frequency. the rescue meds are the ones that you take when you feel like you're getting a migraine. So if you already have the headache, oftentimes it's too late. Those medications are not very effective once the headache has taken hold. So it's important to start tracking what your migraine cycle looks like. And if you've never heard of a migraine cycle, this is another interesting factoid. Migraines can actually last 5 to 7 days, just in the one instance of a headache. So you have the one headache for the day, let's say. Chances are your migraine started 3 days before and will last another 3 days after you've had the headache. What happens is there's all of these other symptoms that you might be getting that you're not associating with your migraine. So for one, I get debilitating fatigue. When I'm having a migraine cycle starting, I usually have a day or two where I feel inebriated, and I'll be stone cold sober, and it's like I'm having a hard time controlling my eyelids, like keeping my eyes open. And so I'll be talking to people and it's like I feel like I'm drunk. And that won't necessarily be for the whole day. It could be like I'll just start getting that later and later in the day and in the evening, and I just have to go lie down because I can no longer keep my eyes open. The nausea, because it's just kind of there every day, it's like my ever-present companion. I can't use that as a reliable indicator anymore of whether or not I'm getting a migraine, because it's just there every day. If I have a day where I don't wake up nauseous, oh, that is like, yeah, we're not nauseous today. We might actually be able to have some breakfast. Woohoo! But those days are very few and far between. But anyhow, you need to start tracking what happens before and after your migraines to understand, what your migraine cycle looks like. So for instance, after the migraine, especially if I've had a couple of days of medication, I feel like I have the migraine hangover. And that is, a lot of brain fog, super, super tired, just massive fatigue, not a whole lot of appetite, no energy to do anything. And the further I get away from the headache, the better I start to feel on the other side. So if you can imagine that there's this cycle, okay, imagine being stuck at the headache stage all the time and never being able to get out of that. So the year of migraines, where I pretty much had a migraine every day in one way, shape, or form for a year before it was starting to be quite well controlled, it was a year of hell. And I'm not going to sugarcoat it. If you've never had a migraine, it's really tough to explain because it's not like a regular headache. I have what I call functional migraines, where I'm not having an onslaught of all the different aura symptoms. So I might have headache with nausea, or light sensitivity with nausea, or light sensitivity and sound sensitivity, and maybe a bit of a headache, or no headache. So those are functional migraines where I can actually do stuff. And in the days when I was still consulting, I'd be able to actually go to the office on those days, and sit with the lights off quite frequently, and sometimes sunglasses even, so that my computer screen wasn't too bright for me. And I'd be able to get a little bit of work. But if I had a combination of the massive headache with the light sensitivity, sound sensitivity, and nausea, just call me done. Done like dinner, put me to bed, forget about me. Just go hide me under a rock for a while until it goes away. And I've had to split it in varying degrees of what the migraines look like, and a functional versus a non-functional day. If I'm having migraines that span more than one day, meaning the headache is present for more than one day, So that just kind of extends the migraine cycle, right? You don't end up cycling out and recovering from your migraine until after the headache is done, most of your aura is gone, and you can really truly rest and that it's not drug induced. Some of the migraine rescue meds make you very, very tired. Some are just like muscle relaxants, they pretty much knock you out so that your brain can have a chance to try to rest. And often I find those don't work very well for me because I still wake up in a headache state. And something else that can trigger headaches and migraines first thing in the morning, very interesting to note, is if you have sleep apnea. I have mild sleep apnea. And as the sleep specialist that I saw explained it to me, he said, listen, if you have sleep apnea, you have sleep apnea. Yes, there's varying degrees of it, but once you are in a place where you are having any kind of sleep apnea, your concentration, your focus, your energy, your quality of sleep declines rapidly. So even if you have mild sleep apnea, it should be treated in some form. And if you have apnea and it's untreated, you can end up waking up with migraines. So you have a migraine first thing in the morning. I thought that was very interesting. And my apnea, we suspect, is caused potentially by the Ehlers-Danlos syndrome, just because my tissues are so, they're just so not pliable, but there's just like so much joint laxity everywhere in my body, and that also extends to the muscle tone and things that you can have in your throat that that help to control your breathing when you're asleep. So I have been referred on for a consult to speak with a surgeon just in case they think that, there might be something there that they can repair or fix. But it's more of a, yeah, let's just have the conversation to see if there's something there, because for the most part, with Ehlers-Danlos syndrome, there isn't anything you can do to surgically repair your, ooh, sorry, I just grabbed my headphones. But yeah, there isn't anything that they can do to fix your sleep apnea if you have EDS. I shouldn't say that as a blanket statement, but there's a very, very slim chance that there's something they can do to surgically correct that. So I'm not too worried about getting surgery for my apnea. It's just something that I live with as well. But it's a very interesting note because most people would not associate their migraines with sleep apnea unless they've actually gone to see a sleep consultant, which is something I often recommend when I'm talking to friends and they're describing what their sleep is like and that they never wake up feeling refreshed and no, they don't have any chronic illnesses. And I ask them, have you ever gone for a sleep study? And they have much, much better technology available now than they did even a decade ago. It's changed dramatically. So pinpointing apnea is a lot easier than it used to be. Because I had a sleep study done probably 15 years ago, and there was no sign of apnea based on the testing that was done at that time. But because they've changed the technology and that's improved, the sleep study that I did at home and not in a clinic, they were actually able to detect the apnea. And that was just a couple of years ago. So very, very interesting stuff. But back to the whole reason why we're talking today is migraines. Just having some water. There are a number of different types of medications that can be used to treat migraines. There's triptans are often used, and there's like 6 or 7 different varieties that are known to be quite effective for migraines. And your doctor needs to be patient as well as you being the patient, because it takes time. You have to have a migraine to be able to try the drugs, and you also have to remember to take them when you think you might be getting a migraine. And if you're not tracking what your migraine cycles are like, it can be difficult to identify if it's a migraine that's starting or if you're just feeling slightly off. So now I kind of have the point of view of if I think it's a migraine that's coming, I take my meds right away. And I have migraines that wake me up in the middle of the night and I can't go to sleep anymore. So I have to get up and medicate properly so that I can at least try and rest in a comfortable position. Because that's the other thing people don't take into consideration is that when you feel like your head's on fire and it's about to explode, really not too many comfortable positions that you can rest in. So even putting my head on a pillow sometimes is too much. So I end up doing weird things like taking a memory foam travel pillow and put my head in the, I guess the U part of the travel neck pillow so that I don't have direct pressure on the back of my head, because sometimes it's that pressure that just makes it even worse and makes me want to cry. Oh my God. Sorry, we're a little all over the place with like this. This is the thing here. I keep yanking on it today, so my apologies for my camera shaking. Yeah, so that's a little bit about my experiences with migraines and my experiences with specialists. I eventually ended up getting referred on to a specialty clinic that we have here in Calgary. We're very fortunate in Calgary, and I guess in Canada, we have two clinics that are devoted to the treatment of migraines. And one of them is in Montreal and one of them is here in Calgary. And the doctors that are at that clinic, it's called the CHAMP Clinic, which I believe stands for Calgary Headache and Migraine, or sorry, Headache and Migraine Management Program, something like that. Anyway, but they're really great. And because all they do is work with migraine patients, you get a very good feeling that, once you've kind of described what your process has been to that point, they usually have a few other suggestions. It's not like they're just like, well, you've tried everything I know. I never even got to the end of like exploring all of the different medications because we found some that worked for me. And they were actually the ones who also prescribed me medication for nausea. And that was kind of a game changer because before that I was having a lot of difficulty controlling nausea throughout the day. And so this medication that they prescribed kind of has a dual action. They prescribe it because for some people it will take away the headache, it will take the migraine away. But it is an anti-nausea medication. It doesn't take my headaches away, but it works wonders on my nausea. So there are things they can do if you are constantly nauseous. There's stuff that you can try, but it's really what medications are you on already and what have you tried? And it's through that process of elimination that off you go, running the gauntlet, trying to find what's going to work for your individual physiology. I could share with you guys, if anyone's interested, what medications I do take for my migraines. But at this point, it's just better to have somebody assess you where you are and get going down that road if you're just at the beginning of your migraine journey. And my sympathies to you if you do have migraines and that they're very poorly controlled. I feel for you so much. So if you have someone in your family who has migraines, and it's interesting to note that if you have kids, they could be experiencing migraines in the form of anxiety, stomach problems, headaches as well, obviously. But a lot of the time with kids, migraines don't manifest with just the headache. They present more as a sense of anxiety or that they're having a stomach ache. And they'll say, I have a stomach ache, my stomach hurts. And that's how their migraines start to manifest. that was really, really interesting when I found that out. And, I've been to information sessions and done so much research on migraines just to try and get control of that part of my life when I was going through that. So you find out stuff that just blows your mind. And it's not like I didn't know that kids could get migraines, but because that's something that is more unique to kids, that the stomach ache part or that they feel really anxious, that's something that after that I started talking to the parents that I knew differently when they were saying, we think that our child might have migraines because, they've got headaches all the time. And when you ask them, do they say that they have a tummy ache quite often? And when the answer starts coming back, yes, and they're like, yeah, we've gone to talk to our doctor, it's like, okay, make sure you mention to them that they also get frequent stomach aches. That's not something that a family doctor might be aware of. It's more something like a specialist would be aware of that. So I'm sharing that with you in case you have a great family doctor that's not very well versed in migraines. And that's kind of the whole purpose for why I'm sharing these experiences with you, is that if you are going on this journey and you don't know what questions are going to be asked of you or what to say, I want to provide whatever insight I can from my experiences. And if there's even one little thing out of that that will help you, then, that's mission accomplished for me. So please share this with anyone that you know that is having a hard time with migraines, or that they just maybe started getting them and it's not really under control. I'm happy to talk to anybody who's going through that as well. So please feel free to reach out and I can commiserate and offer my support if that's something that you need at this point while you're going through the investigation with your doctors. Advocacy is really important to me, and I will continue to be talking about advocacy and how to advocate for yourself and how to advocate for others if you are a caregiver or if you're a partner or a parent, because it's really important to understand how your medical system works where you live, but also what information the doctors are looking for. And it can be really challenging territory to navigate if you haven't been down that before. And, I kind of went full throttle into that journey when the migraines hit full blast. And, it was a learning experience. And I'm glad that I went through that experience because now I have relief from migraines for the most part. I do still have some that send me to the hospital where I have to get a treatment via IV. And I also have something that I can inject here myself. And I've only had to use that once. And that's kind of like my last resort before going to the hospital, because going to the hospital when you have a migraine, it might be necessary, but it's like the worst place that you want to be. It absolutely. So if there's anything you can do to prevent a hospital visit with a migraine, then, for me, I'm like, yeah, let's do it. We have to try everything before we go there. So yeah, so we'll probably have some more conversations around migraines, but a lot of my medical conversations tend to be very interconnected because my illnesses are so very interconnected and it's really difficult to separate them. But migraines are something that definitely can be treated. My migraines are all over the map. There's no pattern to them. It's never the same headache twice in 2 days in a row because my headache tends to shift. Don't ask me why that happens. It just does. And it's a real big pain. But so yeah, that's a little bit about migraines, and I invite your comments and questions if you have any. Of course, if you enjoyed today's video, I would love a big like, because I'm struggling with some severe fatigue today, and I really was just so committed to making sure that I logged an episode with all of you, because I'm very committed to trying to do a video every day for you. So if I can do it, I really try. So just bear that in mind. But yeah, so give us a big like and subscribe to this channel. Don't forget to hit the notification bell so you know exactly when the next videos are landing here on YouTube. And thanks again for joining me. We'll talk to you very soon. So this is SickMom checking out.